Our next speaker is Dr. Bertha Flores. She's the Associate Professor of Nursing at the School of Nursing at the University of Texas Health Science Center, San Antonio. As a practicing women's healthcare nurse practitioner, she has acquired a unique perspective of the needs of women. And today she's going to present to us on Stop HCV, HCC-HCV, a community-based approach to integrate HCV screening and treatment in rural primary care. Dr. Flores, you can take it away.
Thank you. Thank you for having me today. I appreciate the opportunity to present today our program, which is Stop HCC-HCV. Today, what I'll talk about a little bit is about how our program was implemented and how we help to decrease some of those barriers. Just to tell you a little bit first about the program, this is a multi-level, multifaceted approach. We provide counseling, evaluate, and treat for hepatitis C in 4 clinics, systems, or 28 clinics throughout South Texas. South Texas, we also include different components, including medical records modifications. We have an app, we have a website, and the main thing we do for those patients who are uninsured, we have teleconsultation hours. And we have also developed a website, which I'll talk a little bit about more in a few minutes. This is the map of Texas, and we are right here in South Texas. This South Texas is a 36-county area, primarily with a majority-minority Hispanic population. One of the things we do for in the program is education, and we have education for clinicians, for staff, community health workers, community, and patients. And so, for example, some of the education we provide is for providers and staff. We do this in several ways. We have webinars, we have face-to-face presentations, and they're also available in the website so people can take them on their own time. So these are just some of the examples of the education that we have put together. We have found out that education does show improved HCV knowledge and attitudes among providers and staff. We have also developed short infographics that providers and clinicians can take a quick look. And so this is also a sample of some of the informatics and handouts that we have produced. For community and patients, we also have provided a website. We have testimonials. If you go to the website, for example, we have patient testimonials. All the programs that we developed were with community input. All our community education, including leaflets, they are all in English and Spanish, and they all have been with community input. So for example, just to let you know a little bit about the community input when we were developing the website, some people thought that some of the information was too long or the testimonials were too long. And we used that information to shorten the information. So everything we have done is with community input. Here is just an example of some of the information that is available to the community. All the leaflets are also developed with 6th grade or lower reading level. Again, they are in English and in Spanish, and developed with community input. The other thing we developed is an app. So for example, all the clinics that we work with, of course, this is a tool to provide additional education. Again, it is in English and in Spanish, and it was developed with community input. But the providers can use this as an additional tool to provide information to the newly diagnosed. And we are working together right now to put this on the App Store. So that's the next step. But for right now, we have all the clinics have tablets where when the patient comes in, they can use this as an additional tool. And it also helps decrease the technological divide, for example. So all the clinics have access to the tablets and the app. And like I mentioned earlier, we have a website. The website is the stophepatitisc.com. And that is, again, we have information for clinicians, we have information for the public. The other thing we have is Hepatitis C Echo. And this Echo, it's usually about an hour. We usually have experts and people can join from many parts of Texas to join this ECHO program. So some of the things that we talk about is how to decrease barriers. So as you know, the guidelines now are implemented to screen all adults for HCV. However, there's not necessarily a primary care model. We also suffer from physician shortages, for example. You can see specialists 1 to 456, gastroenterologist is 1 to 28,000, and then infectious diseases is even higher. They also have some other unique challenges here in our population, which are primarily low-income minority populations. Lack of insurance coverage, for example, stigma, lack of knowledge, poor access to specialty care, and also transportation, for example, to come to a big center. I think similar to how our first presenter was talking about Alaska, we have a lot of rural communities and lack of transportation is an issue. And of course, the cost and availability of the DAAs. So some of the ways that, that we help decrease or eliminate these barriers, for example, is we have navigation. And the navigation helps patients obtain the DAAs through the Pharmaceutical Assistance Program. And we have been very successful. And again, how the presenters mentioned previously, these are for the uninsured. If they have insurance, then Medicare or Medicaid can cover those costs or other type of insurance. We also use a teleconsultation model, which is different than the ECHO. And I'll talk a little bit more about that next. For example, also some of our screening criteria originally, as was recommended, was for all baby boomers. Later on, we added for people who have at least 2 abnormal ALTs. And then now, of course, we include all patients per new screening guidelines. Now, for those that are uninsured, then they can participate in the STOP HCC-HCV program. If they agree to participate on the program, of course, then it's the assistance with the navigation, assistance with the medications, all the labs are covered, all the ultrasound is covered as well. And so far, we have screened over 32,000 patients in Texas for hepatitis C. We have, 1,600 patients confirmed with HCV infection. We have referrals to specialists and also help the PCPs treat the patients in their clinics. We use the teleconsultation model. This is individualized management. Usually we arrange these consults during the lunch hour where most clinicians are available in between patients, so it's convenient. Usually takes about 10 minutes. They present the patient and the hepatologist then provides the recommendations. They present information on the labs, any imaging, some demographic factors, medications, comorbidities, etc. And then they have an individualized plan. And then the PCP also can ask additional questions. And also the PCPs are learning how to treat HCV in their own clinic. This is some of our workflow, for example, that you can see those that are identified and then can be followed up with education and labs, education including the app, schedule the teleconsultation, applications for those that are uninsured for the DAAs, start the treatment. There's a 4-week optional follow-up, end of treatment, and then the 12-week labs, and all the way to cured. So the teleconsultation office hours, for example, are in 4 clinic systems in South Texas and the Rio Grande Valley. We have 87 consultation calls attended by 28 providers, 32 case navigators, and we have managed plans for at least 314 uninsured patients. And of course, this is an ever-changing number. For example, next week we have 4 teleconsultations scheduled already. And this is how the care cascade can look like. And again, this is ever-changing. And there's always, of course, a lag because there's a 12 weeks SVR. But we have been successful. There is some loss to follow up, but the percentage is small. But there is some patients that are lost to follow up for many different reasons. I like to thank then, of course, all our wonderful team that helps us and all our partners. Thank you very much.
Thank you, Dr. Flores. That is amazing. Thank you for sharing your results from this Stop HCV program, and really happy to see that you have resources available for healthcare providers on the educational materials. So I don't see any specific questions. Let me quickly check. I don't see anything. Oh yeah, there is one. Is this part of the TECH program with Baylor Group in Texas?
No, this is, we have separate funding with cancer prevention. And then also we have a P30 NIH grant.
Thank you.